Friends, we're going to talk a little bit about neuromanipulation in the brain and why it's important. So your brain is held inside your cranium and inside your skull by meninges. Meninges is thickening of the dura, and those thickenings are called the tentorium and the falx. The tentorium is kind of the base of the skull. It runs parallel to the ground, and the falx is perpendicular to the ground, and it separates your two hemispheres. So not only do they hold the brain in place, but they play a huge role in fluid regulation and fluid flow within the brain. And we want to make sure the fluid is flowing well within our brain for overall health. So the fluid that is in the brain are things like blood flow, arterial and venous, cerebrospinal fluid, lymphatic fluid. It's really important, like I said, that these things are moving and that it's balanced. So we can affect that fluid control and therefore affect the pressure in our head. And the easiest way to do so is to affect the meninges and the bones of the cranium. And you do this by affecting the nerves and the nerve input and the sensory input to the meninges and to the cranium. So the two main nerves that we'll work on are the trigeminal nerve and the nerve of Arnold, also known as the greater occipital nerve, that comes off the cervical plexus, just comes off the neck. So if you've seen a previous video of mine, we talked about how the trigeminal nerve kind of comes across here, and we did some self-massage there. So I will kind of put that in the bottom of this video as well, but that is one video you can go back to. For today, we're going to talk about how the upper kind of branches of the trigeminal nerve come up into the skull, and they kind of intertwine or anastomosis with the cervical plexus at the back of the spine, that greater occipital nerve. So some ways that you can really affect the sensory input to the trigeminal nerve is through a little massage and pulling of the head there. So the number one way, my favorite way to do it, is to quite literally give yourself a massage on your head. So sometimes you'll start at the base. And actually, before we do that, let's just do a little check-in. So before you do that, you want to check in. Close your eyes, kind of notice how your head feels. Notice if there's any pressure in your head. And just kind of see what's going on there. You can also check your mastoid process, which is kind of right along here, and notice if one is more prominent than the other. And prominent means kind of bigger or more noticeable. And the prominent one might be more tender, so that's my left here. You can also check your resting heart rate, because a lot of times when we're working with the trigeminal nerve, it feeds back to that vagus nerve, which is going to have an effect on the parasympathetic nervous system. So you're kind of affecting that parasympathetic nervous system and getting it to kick into place. So now to what we're going to do. You're going to take your hands and you're going to start with shampoo fingers. You can massage the back of your scalp, the sides, the top, really just kind of gently massaging everything here. You can also just take a gentle pull of the hair, like you're not ripping your hair out, but a really gentle pull here and here, kind of behind the head, to the side, really getting at that greater occipital as well as the trigeminal. And you really follow what feels good in your body. Like there's no perfect way to do it or perfect place to start. You kind of notice what your body wants and where you go, and really honor that. Another way to kind of access this neuromanipulation is through the ear, and we'll do that in another video.